We are literally breaking it down to the very basics, to the anatomy. So
Yes.
this is like your anatomy. Like think back to college or med school or whatever,
Yes.
right? Like anatomy
Health
101.
class, yes.
Health class. Like
Yeah.
what's the anatomy down there? What's normal?
Hi everyone, we are so excited to welcome you to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm your co-host, Dr. Ashley Amalfi, and I'm joined by my dear friend and colleague, plastic surgeon, Dr. Smita in New Jersey. Hi Smita.
Hi Ash, how are you?
I'm so great. I'm so excited. You
I
guys,
know, we've got a great one coming up, guys.
This is great. Yeah, because labiaplasty is always like our biggest hitter with our podcasts, and whether you're watching on YouTube or listening on Spotify, labiaplasty topics always have the most views. And so we thought, let's bring you guys a whole series about labiaplasty. So don't need to look anywhere else. You're going to get real facts from plastic surgeons, and we're ready for it. So we're going to start with some basics, right, babe?
Yeah. I mean, we are literally breaking it down to the very basics, to the anatomy. So
Yes.
this is like your anatomy. Like think back to college or med school or whatever,
Yes.
right? Like anatomy
Health
101.
class, yes.
Health class. Like
Yeah.
what's the anatomy down there? What's normal?
Yes.
You know, like
I
what
think
is it?
people
What are the
don't
different
know.
parts, right? No,
Legit,
people don't
like
know.
guys, girls, people just don't know. They're like afraid to look. They don't know what it's supposed to look like, what the parts are called, and how do you like talk about that with somebody if you kind of don't know the basics. And so we're gonna just take you through it so that when you go and you have your consult with your doctor, you can actually use like the right terms and tell them what it is that bothers you, I guess, right? So where should we start? What do you think?
Yeah, I mean, I feel like maybe the easiest is to go like outside in, right?
Sure.
So,
Perfect.
Let's start from the outside in. So, and the other thing about this that I think is so great is it's just like a better, you just have more tools to be able to describe to us what bothers you, right? At the end of the day, the more educated you are, the better you can communicate. We could be on the same page when you come in for your consult. So, outside in. Labia majora, right?
Yes.
So that's like the outside part. What you see, that's where, you have normal pubic hair. I think that's the area that most people are familiar with, right? Because that's what you sort of see every day.
Yeah. And I think what's interesting, and what I kind of point out to patients about like that external part, the labia majora, and like the whole area, which is called the vulva, is when you stand up, the labia majora doesn't always kind of close in the middle. It kind of has like that clamshell appearance, and the outer lips come together, but that doesn't happen in everyone. And so I do see some people who like ask for that, and sometimes you can see some of the inner anatomy in the middle. So there's kind of like 3 parts to it, and some people have 2 parts where their labia majora like touch in the middle. So that's like the most basic outside part, labia majora. And we definitely should do an episode talking about that too, because there's totally stuff that we can do related to that. Okay, so then working in from that is the labia minora, and sometimes people call that like the inner lip. So those are thinner, and they're like little thinner lips of tissue. And honestly, like when we're talking about labiaplasty, this is usually the part that people are talking about that bothers them for some reason, right? Because they can be all shapes and sizes, and it's totally normal. I always say it's like breasts. They can be big, small, saggy, uneven, all those things. And so that's the skin that hangs. And in some people, especially people who might want a labiaplasty, it hangs really low. So sometimes it hangs outside that labia majora, so that when you stand up, those little inner lips, the thinner parts, are hanging lower. And that's, I think, what bothers some of my patients, right? Same for you?
Yeah, no, I would agree. I think that is one of the biggest complaints or concerns that patients have, because it can, if it does hang, Sometimes, that's where the irritation comes into play. It can get caught in your clothing, or, if you're working out, it can almost like cause a chafing kind of effect. So, and that's typically, like you said, when it hangs below the labia majora. When the majora closes, the two sides of it, you can see it protruding. That's all normal, as you said, but sometimes it can cause that irritation, or people just might not like the appearance of that. And that also can change, including the majora, as we, go through life with hormonal changes and aging and all of that stuff. But I think that's the biggest sort of concern.
Yeah, and you know what else can happen, like if you're looking at, your own anatomy, when the labia minora are longer and they are getting irritated like that, they sometimes get dark. So sometimes, and that's just from chronic irritation. So sometimes like the edge of that tissue is a little darker, and people don't like that pigment part, and it's just irritation, just like you can get darker pigment in areas of the skin that's kind of chronically rubbing together. So sometimes that can happen. Okay, so let's go in like a little bit further. The other part that we sometimes address in labiaplasty is the clitoral hood. So the clitoris is like the most sensitive, small, like little pea-sized area in the very front, or the anterior part, and it has little lips of tissue around that, and that skin can sometimes be shorter. It can sometimes hang longer and totally cover the clitoris. Sometimes it's retracted a little bit back, in that you can see that little area more. So that extra tissue on the top there, it's kind of like akin to foreskin, and that's called the clitoral hood. So that's just extra tissue there, right?
Yep, exactly. It's just extra tissue. And again, it doesn't really, I feel like most patients don't really bring that part up as far as a concern, unless it is sort of covering the clitoris, or sort of is tight and causing other issues. Or if it's just redundant, and sort of connects with the minora and protrudes.
Yes. Yeah, because it kind of all should flow. Like if it's, if there's a lot of tissue, oftentimes there's extra tissue everywhere. If things are a little bit shorter, usually it's uniform. So you want to make sure that it doesn't look out of place. And then the good thing to know is where those clitoral nerves lie, what the sensation. Obviously everyone's always really worried about that. That's why you're seeing someone who understands the anatomy. That's why you're seeing a board certified plastic surgeon. Those nerves lie very deep on the deeper tissues of the body, of the clitoris, and they run deep and in the middle. So if we're ever going to address the clitoral hood, we're going to do that on the side, so that we are far away from those nerves, because obviously we want this to be safe and for you to be sensate after. So those are anatomy things that you guys don't need to know, but we certainly do, and you want to make sure your provider absolutely understands that. That's kind of like the important stuff.
Yeah, and I think that's sort of the biggest thing, because I'm starting to see patients that have gone to non-plastic surgeons, non-OBGYNs, like people that are completely unfamiliar with that anatomy, trying to offer these procedures. And this is an area where you do not want to mess around. You want to go with someone who is experienced and understands the anatomy. So I think so that's the biggest thing.
So important. And then I guess if we're looking a little bit deeper, there's sort of like three openings from of the vulva from top to bottom. The top one is going to be the urethra, so that's where you pee out of. And then the next one back in the middle is the vagina, so the inside of that is called the introitus, and then the posterior one is the anus. So those are the three kind of openings all the way in a row. And there are some sort of vaginal rejuvenation techniques that do restore some of the muscle anatomy of the vagina to tighten things up. There's certainly a lot of like laser devices and radio frequency devices that can tighten the lining of the vagina, and sometimes those are done as like combo procedures with labiaplasty, where we're addressing the skin. Sometimes there are other things that can be offered by different physicians. So in general, sometimes the term vaginal rejuvenation is used, and that's kind of nice because it refers to all of these things. But what we don't want people to think is that if we use the word rejuvenation, we don't want you to feel like you have to do something, right? Because this is all
Right.
normal stuff. You don't have to do anything. But
Right.
if you want to, I don't know, I feel like we should empower people to do what they want, right?
Yeah, I know. I mean, I think that's why I love that we're doing this series, because I think people, obviously it's a very sensitive area that a lot of people
Yeah.
don't feel comfortable talking about it, or they feel shy about it. Or maybe they have brought it up to, let's say, their OBGYN or whatever. And, of course it's normal anatomy. So they were told it was normal anatomy. And so they sort of, shied away from bringing it up again. But I do think nobody talks about it. There's not a lot of information out there. And so this
Yeah.
series, I mean, it's literally, these are conversations we would have if you were sitting in our office right in front of us. So I like that we're just sort of dedicating a whole
Getting it
series
out
to
there.
this, so you
Yeah.
guys can just listen to this in the comfort and privacy of your own home, and then hopefully come see one of us or another board-certified plastic surgeon to discuss further if these are concerns that you have.
I love it. So hopefully
Yeah.
you guys learn something, you learn the anatomy, go take a look, see what it is that you're talking about so we can kind of talk about the same thing. And, obviously we'll walk you through this too, but I think it's important to kind of know what you're dealing with and be educated. And so that's what we're here
absolutely.
for. So we're excited. So much more info to come on labiaplasty. Make sure you guys subscribe on Spotify and YouTube to Lipstick and Lipo, your unfiltered guide to plastic surgery. See you later, babe.
See you later.